I thought I was going to go around.
I had no chance of recovery.
Obviously, China has something to hide.
Rohit, first explain your journey. Explain why you think you and those in your family are lucky to be alive and that you're back virtually from the brink.
My virus load when I started was not so high, and I thought that I spoke to my doctors and they started me on Fabiflu and some other vitamins and ivermectin and whatever they could give me, and I really thought that I'm strong, I'm fit, and I should be able to fight it out and get well at home. I thought I was going to go around. I really at one point, and then I get this call saying that there is one bed, immediately leave. And the only thing I asked for, I was ready to move. The only thing was asked for us to see my family.
I have been waiting for Corona. I was under the illusion I'll get sick for 5 days. I'll have some cough, some fever, then I'll be okay. So I didn't expect that this Corona can get into your lungs. And the day I landed in the hospital, they did run some blood tests and CT scan. They said it's very bad. And from that day itself, in the evening, oxygen started falling. So this is very unpredictable disease.
7 महीने आईसीयू में, कोविड आईसीयू में लगातार डे एंड नाइट काम करने के बाद मुझे अक्टूबर में कोविड हुआ. कोविड से मैं रिकवर होते ही दिसंबर में आई गॉट राइट साइड पैरालिसिस अटैक, जहाँ पे मेरा जो फेस था वो राइट साइड डेविएट हो गया, पूरी तरह से टेढ़ा हो गया. आईसीयू की मशीनें जो आपकी कानों में आवाज करती है वो दे टेल्स यू दैट यू आर गोइंग. आई हैड नो चांस ऑफ रिकवरी. सिटिंग हियर टॉकिंग टू यू, being alive is a blessing.
I didn't know whether I was going to be corona positive or negative. It was a nightmare. It was so frightening. So I got a phone from a BMC doctor. He says, Himani Shipuri, corona positive hai. For a minute, everything stood still. So he says, because I had comorbidities, I was diabetic. He says, it's better that you get admitted.
So my son is 4.5 years old. And when I was tested positive for corona, I literally started crying because I knew that I have to isolate myself, I have to quarantine myself in the room. Me and my husband and I both were corona positive. And I was so tense and worried that how things will be managed. And thankfully, with grace of God, my brother-in-law, he was COVID negative. So he took charge and he literally took care of him. I don't know from where he got that strength that he literally didn't bother me and was actually waiting for the time when I'll get negative and can go to him and hug him and kiss him and cuddle him.
Will this third wave hit children the most, as some are arguing?
The new variant, the new mutant that we are saying, the Indian mutant, there is exceedingly small evidence to suggest that it is actually causing a lot of infection and serious infection in children. There is proportionately a higher number of children which will be infected. I don't disagree with that. But in absolute terms, are we seeing an increase in number of cases in children? And that is the question. Because the disease spectrum in children still remains largely asymptomatic or with mild cases, and the mortality is exceedingly small.
In the second wave, definitely there are, in absolute numbers, more cases which we see in pediatrics. We have not seen an increased percentage of serious cases as of now. We are seeing mild cases. Most cases are mild, and for them we are not admitting them. We are doing home consultations or video consultations. We prefer children to be at home. But the serious patients are there, but far and few in between, and especially those who have underlying diseases.
The genotyping is the 617 variant, which is basically what we are seeing in India right now. So the increased surge of COVID cases in India right now are being said because of the B617 variant. So definitely we are seeing kids also infected by this. So majority of the children are all mild to asymptomatic and can be taken care of at home. Very few get seriously sick, and even in this we really need to have more genotyping, more testing to see if it is really coming from the 617 variant. So there's a lot of research and studies that need to be done for this.
You spoke to the scientists who are now seeking a transparent and data-driven investigation into the Wuhan lab. Why the insistence on the Wuhan lab, Kiran?
Now, WIV is one of the most, advanced, lab centers in the world. So they have the capability to perform numerous projects, numerous researchers that are really advanced. After 2012, they start probing and they start researching on almost thousands of different coronaviruses, specifically on horseshoe bats, after this April 2012 incident. So we also have a lot of scientists that are quoted before the COVID outbreak, that on the amount of work that has been done in WIV. So there are a lot of information that also corroborates to maybe something that went wrong at WIV.
Okay. We are doing pure scientific research, and so the 18 scientists now which we have demanded that whether it is a lab leak from Wuhan labs, I think that's a very valid hypothesis to be investigated according to me, because Wuhan had three different laboratories, and WIV was the most premium lab where most of these coronaviruses were researched, especially the SARS type.
Investigating the origins of the pandemic is critical for another reason. This is not the first deadly disease to spread globally from China.
Yes.
We all know about the 2002-2003 SARS outbreak. It was the first pandemic of the 21st century. It was gifted by China because the Chinese sought to cover up the SARS outbreak in China. But China has been the origin of several earlier epidemics.
Yes.
So getting to the bottom of how this virus arose is so critical to preventing a future pandemic.
November, December, it started. Then the deception that China engaged in, the complicity and the pressure that it applied on WHO, and WHO sort of took on everything hook, line and sinker what China was feeding it. And they delayed declaration of the pandemic till the middle of March last year. Obviously, China has something to hide.